Dr. Larry Burchett is back with us again on Last Week on Earth, a podcast that I wish had a different name during these troubled times. Thanks for joining us, Doc.
I don't know. I think it might be the right name for the right time. Good to see you.
Thank you for being here. So, last time we talked, quarantine had just begun for everybody. We were just being
Hmm.
locked down, and I don't know that anybody was taking it as seriously as it needs to be taken. And we're living in a different world now. It has now been
No,
basically 3 weeks locked down across the entire planet. And so, what's changed? Where are we at? Please fill us in on everything.
God. I mean, I think exactly what you said. Everybody's taking this more seriously, and since then, very sadly, we've seen mainly in New York and New Jersey, it's real. You know, people are dying. To be frank, hospitals are really starting to get overloaded. They're starting to build extra hospitals in convention centers, calling for a draft of doctors and nurses. It's getting real. But on the other hand, what's good for California, we haven't blown up like that, which has been really interesting. I brought you some numbers that I want to take a look at some point in this to kind of give you more numbers on exactly what we're seeing and
Do you
talk
want to hop
about
into it right
why.
now? Let's hop into those right now.
Let's do it.
Okay,
So
so
the first one I've got for you, when I looked at these numbers and crossed them with the CDC and other stuff, they're pretty on. 336,000 in the United States with about 9,600 deaths. But what I really want to focus on there, down below, and anybody can get on this thing, worldometers.info, they update it daily. Down below, when you look at it at the breakdown by state, number one is obviously New York, 123,000. New Jersey, 37,000 is number two. You put those two together, and that almost accounts for half of our cases in the country, which is remarkable that really is a nidus. It really is where the epicenter of this thing is, not only in our country, but in the world right now. But what I want you to note, especially for us in California, California is number four, only 15,000 cases.
mm,
New York, New Jersey combined have 10 times what we have in California, which is surprising to me. I mean, I don't know what your thoughts on this, but I thought, this thing first started in Washington State, and I thought with China, I thought San Francisco, San Jose, LA would be much earlier of a port to get this and to blow up. But there's a real telling number here. If you look more at the details on these things, it breaks it down in terms of cases per 1 million population and deaths per 1 million population. Of course, New York and New Jersey are still high. So I want to point out when you break these cases down by how many people are in the state per million population, New York 6,000 per million, New Jersey 4,000. California is only 384 per million. Even when you look at Michigan, Louisiana, Massachusetts, Florida, all of those other guys are at least double of California.
so does that mean we're doing the best job of getting the messaging across?
I think there's a lot of factors. I'm not going to pretend like I know. I think social distancing and everybody staying at home, I think people in California have listened. I think the governor acted early enough. I think sun and the UV may make a difference. This is a warmer climate, but
Killing the
this is a
virus.
really remarkable difference. So, one of the questions you were asking me, can we get out now? Can we do whatever? I think like now's the time to double down and to stay on this. I think we have done good as a state. I would encourage people to keep it up. I know it's hard. I know it's hard.
We also have the smallest deaths per million, which is, good news for California. Second to Texas only. And people are probably still mostly shooting themselves there. That's the main way they're getting killed over there. So, they love their guns. You got to love them for that. They're the one place that's really keeping this gun loving vibe alive. So, yeah, that's a question that I had. I had thought that perhaps, and I asked on my social media, and people like went crazy, and I did it largely to spark this conversation because I don't think the messaging is coming across very accurately. I don't think people are really understanding why they have to stay at home, why they can't just stay 6 feet away, why anything they touch could end up killing an old person. So if you could explain that, because we were wondering, like, if we're quarantined for more than 14 days and then our parents are quarantined more than 14 days, can't we visit each other? And people were going nuts saying, no, you can't, because even just walking through the air to get into their house or vice versa, this thing, it's shown in certain tests, it is airborne. It can stay airborne for a few hours. You could walk through a cloud with these droplets and be infected just right as you walk into your parents' house and not even know it, and then give it to them. And so, what's your thought on that? Even if two groups are quarantined, do you agree that it's still not safe to do?
I mean, there's a lot of questions in there. This airborne thing, to me, this seems to be one of these. Yeah, theoretically, you can find it airborne. I don't think we should think about this as being paranoid to breathe air everywhere. It's not floating everywhere. The main way that this thing is transmitted is still close contact, which if you look at the way Asia, Singapore, these guys defined it, it was within 6 feet with somebody that had it coughing, sneezing. Um, they did a study in San Francisco on the the virus that they got, and they found that 50% of the cases came from outside the state, meaning Washington, China. But this is almost equally disturbing. 20 or 30% of them came from healthcare workers. So either the healthcare workers brought it home to their family, and then from there, their family spread it out, or these are people that went in and got checked in an ER or whatever. And so, when talking about, well, if everybody stayed at home at once, couldn't we all just go out then later? But there's still going to be virus circulating. I mean, if you think about it, like you got the grocery store people. Think of all these essential folks who are still working and doing a good job that unfortunately it's hard to not be exposed. I mean, you've seen these, like, I don't know if you've seen these at your grocery store, these glass barriers now between the cashier and the person. Like there's no way
I
to
shop
shut
in a
it
very
down.
bad neighborhood. They always have that up there.
My, mine is not the same, and it's new. And my cashier person is all freaked out now.
Of course, and they should be getting hazard pay, and they should be getting tipped by people, the delivery people. We watched the video. I understand there was even some correction from the white bearded guy that showed the doctor that showed how to decontaminate your food, disinfect your food by dividing a line on your table and having stuff before you clean it, and then have a Lysol drenched rag, and then clean every item of food before you put it onto the clean side. We've been doing that. We've been cleaning all of our food items outside the house before
Wow.
bringing it inside to make
Wow.
sure that we're not having any chance to bring food inside. From the one market trip that I went on when I think I actually got the coronavirus, and then I'm luckily over the hump of that now, being a few weeks having passed. My sense of smell just returned. That's why I've got a lemon here. The
Really? I
great,
didn't know
the
that you got it. What was your exposure? What were your symptoms like?
So I was pretty darn sick for a couple weeks. I had extreme body aches all over, um,
Yeah.
just pain in my back and my legs and my arms. Some degree of fatigue, not extreme, but sometimes, like I would do my social distancing social club show for just 90 minutes. I would end and I felt like I just ran a marathon. Like I felt very tired.
Yeah.
I had a mild cough, just a few coughs a day, luckily, but kind of an
Yeah.
underlying wheeziness that was always there. And I had runny nose, sore throat, and stuffy nose. And then I literally lost my sense of smell for a week and a half. I could not smell anything.
That's funky, isn't it?
Very weird experience. Yeah, although it made the not showering definitely better for me personally. No comments about how it affected my girlfriend.
So, I mean, I would point out, you know, the symptoms that you're talking about are not the classic fever and cough
I did
that
not have
was kind
fever.
of, yeah, that we were first really, I mean, you had a little cough, but it didn't seem like that was prominent. Like the body aches were kind of more for you.
Totally.
That's common. Some people even have abdominal pain, diarrhea, vomiting. We kind of found out that, what it is, more than just that.
So, do you think I had it based on those symptoms?
You could, and I was just going to bring it. It's possible. It's a maybe, and the only way we would really know is if you had a test.
Right.
So there's two tests, right? There's the one where they swab you, and you get an answer of positive right now or not, meaning it detects the virus in
Right.
the swab or not.
And I love
But
people shoving stuff up my nose usually, so I'm anxious. I was anxious to get a test, but I couldn't get one. So then, what's
I
version
would
two?
I'd be glad to take care of that for you anytime.
That's really nice of you, man. You're a man of the
The
people.
opportunity to. Um, the other test is a blood test that demonstrates immunity. So if you
Antibodies.
get exactly, if you get the virus, your body creates antibodies, and now they've got a good test that specifically detects the corona antibody. Now imagine, Ben Glebe, if you got the antibody test, you could basically walk around with a piece of paper and say, I am immune, which means a couple things. You're not going to get sick and you're not going to give it to anybody. Even more importantly, in other words, you would be free. I'm convinced this is one of the ways that the country is going to open up is that that antibody test becomes widespread so that the people who have had it, cleared it, and been okay, they can re-enter society.
So, you're on the front lines. You were in the ER just a week ago. Do you have
The problem,
tests?
yeah, so there are tests. There's two, in one of the places I work, there's two tests. One of them is run by public health. I have to call public health. Now they're answering the phones. They weren't before. And I have to say, hey, I got this patient. We have to talk about it. Those tests, the good thing about them are they turn around in a day. So you get a result in about a day. But the problem is they reserve them for people that are sick enough to be in the hospital or people who have the potential to expose it to a large group of people like nursing homes, prisons, whatever. You want to know if those guys have it or not. But if
Mm,
it's the average person who's like going back to their home quarantine, public health won't allow that 24-hour test because they don't have enough. We're
right.
still stuck with not enough tests. So they get a test. They do have a test, but it's about a 1 week turnaround. Now, one place that I'm working, they are doing these drive up tests, and though the result for those may be 2 or 3 days, but it still could take up to a week. So testing isn't perfect.
And so, another question related to that, and on PPE, you guys are okay because you're in more rural areas.
Well, right now it's okay, but there's still this overall strategy to conserve it because what happens if we surge? Let me give you one example because I was just so fired up about the PPE thing. I was like, this is ridiculous. We don't have enough. And then I watched one patient come in. We put him in room 3, the isolation room. I went in with the nurse. That was one set of PPE, mask, face shield, gloves, the yellow gown for me and the nurse. And then we did a whole bunch of stuff for the patient, right? So the person that drew their lab, they had to put it on. And then the x-ray person had to put it on. And then if they would have got respiratory therapy, they would have had to put it on. And then every time the nurse goes back in to give another, so
A
like
whole
you can
nother
see
set each
how,
time.
well, no, you can sit, each person gets a new set. We've been saving them. And for one patient, the nurse will re-wear the same one over and over.
Wow. Not ideal.
But you can see how, and that's just one ER visit. Imagine if somebody's admitted to the hospital and they
Right.
have all kinds of, maybe they have a cardiologist and a lung specialist and an infectious disease, and just like you can just see how we can burn through this PPE really
Right.
quickly. Now, I'm not saying you don't like, you know, I don't want to stand. I'm going to stand with my brothers and sisters on the front line and say, hey, we really need to be protected. But when I saw that, I was like, God, we're burning through this stuff.
But so when Trump accuses the New York hospitals of somehow stealing or hiding PPE, and he's like, "Look, there's 300,000 of them. A lot of people are saying there's 300,000 going in, and then I don't know if they're going out the back door. Some people think they're going out the back door. You should investigate it as journalists." He's just not doing the basic math that if you have like 300 patients in a day and you're having to use multiple sets per patient and they're there for several days, the shit just burns through. You get into the hundreds of thousands very quickly.
I think we're just using it.
Do you ever put on the yellow and look in the mirror and think, I should go cook meth in this? This is a very meth cooking, Breaking Bad type of outfit.
No, I did take a couple pictures in the yellow stuff the other day just
Can
to
you send me
document.
one so I can show the audience?
Yeah, I'll send you one.
Very kind of
It's
you.
it's a pain. I mean, to be honest, it's a pain in the butt to get in and out of that stuff. Donning and doffing, they call that. I have no
I'm
idea.
not going to call it that. It's very stupid sounding.
I'm running out of battery on this thing. I may die on you.
It's okay. We're about done.
The other thing, let me just show you this. This
Don't
is the
die
other
on me.
one.
We need you on the front lines.
I know. Well, the computer's going to die on you.
Oh, the
You
computer.
can, let me just say this. You can look up your public health, county public health website and see how much corona is in your town.
How do they look that up?
Type in public health and then whatever your county is, and the county public health will list it.
I'm losing you. I just lost the audio. Thank you, Doc. Great to see you again. My friends, that was a interesting conversation with Dr. Larry Burchett that I hope gave you some perspective and a sense that while even people in the medical community aren't always knowing exactly what the scenario is with this rapidly unfolding pandemic and a virus that we don't understand well, to give you a little bit of perspective that numbers in certain places aren't as bad as you think and that we can take precautions to make sure that we keep it under control as best that we can. There's a lot we can't control right now, but there's certain things that we can control, and that is our state of mind. That is staying home, making sure we're not touching things. Definitely stop touching old people. That's an important tip. But just in general, try to accentuate the positive during this crazy time. You know, there are some nice things. Walking the dog, I'm seeing children with beautiful, colorful chalk drawings on the sidewalks. There's hopscotch in my neighborhood on the sidewalks. I've gotten my hopscotch game back for the first time, honestly, since I was about 9 years old. I am hopscotching like a champ. It definitely has been hurting the knees in an aggressive way, so I need to tone it back, or at least stretch pre-hopscotch. But I'm teaching soon a hopscotch Zoom workshop where I can teach you to up your technique. I've been walking around with glasses of wine while walking the dog because no one's enforcing laws like that right now. Open containers, the least of our problems. And you're home, hopefully, with your loved ones. Hopefully, you're not by yourself and you get to spend quality time. It's like an extended camping trip, a fort in your living room. And we don't know when it's going to end because it's so much fun staying home. Look at it that way. Part of that's a lie. But if you have to lie to your brain once in a while to feel better, there are definitely worse things. Stay safe, everybody. Until last week, next week. This has been Last Week on Earth.
Last week on